A new variant of the novel coronavirus has been identified in the French region of Brittany. On Monday evening, the French Ministry of Health put out a statement that said the mutation was found by way of genomic sequencing in a cluster of infections in a hospital in the town of Lannion. 8 of 79 COVID-19 patients turned out to be carriers of the new variant, nicknamed le variant breton. Initially, they tested negative with gold standard PCR tests, despite presenting with typical symptoms of COVID-19. But later, coronavirus infection was confirmed with analysis of blood samples and tissue in the respiratory system. All 8 patients have since died. Preliminary research results do not indicate the new mutation causes more severe disease or is more contagious than other known variants. However, more research will be needed to establish this with certainty. Clinical investigators are also attempting to determine the variant's response to vaccination and antibodies from prior coronavirus infection. What's remarkable about this particular mutation is that the novel coronavirus may have already evolved in such a way as to bypass detection by conventional PCR tests. Last month, Finnish researchers also discovered a new variant that is undetected by at least one standard PCR test, though evidently not all conventional PCR tests, as appears to be the case with the new variant found in France. As a result, the World Health Organization has assigned the latest variant to the category, variants under investigation. The announcement came as France and most of the rest of Europe battle a resurgence in coronavirus cases and hospitalizations, driven in part by the B.1.1.7 variant, which has become dominant throughout the continent. New variants are not a surprise. Variants are popping up everywhere and will continue to do so. The novel coronavirus must evolve to survive. In fact, viruses constantly mutate. Some mutations are relatively benign, while others are more worrisome. Each time a new variant emerges, researchers must investigate the extent to which it is more deadly or contagious than other known mutations, and the degree to which it reduces vaccine efficacy. Furthermore, as is the case with the new variant found in France, clinical investigators must assess ways to adapt PCR testing protocols to possibly enable detection. At present, the biggest concern with variants that escape detection is that they may fuel spread of the disease. And this, in turn, can spawn new, more potent variants. Indeed, the driving force behind the emergence of variants of concern, such as the B.1.1.7, B.1.351, and P.1, is the massive number of infections globally. Uncontrolled spread of infection allows more and more mutations to develop, which increases the likelihood that new virus variants will emerge that can evade detection by conventional PCR testing, and worse, elude vaccines.